A new poll out today suggesting Canadians are much less satisfied with our access to health care than Americans are. Hilary Johnstone is in Ottawa looking at what Angus Reid is putting out this morning. It's an interesting read, and tell us more about it, Hilary.
It is, Heather. And of course, there is this narrative, or there's this perception up in Canada, and we've heard this from the president of the Angus Reid Institute, that our access to health care is better than what it is in the United States. But according to the results of this survey, Canadians don't feel that way, at least not right now. So what this survey found was that only 15% of Canadians said that they were comfortable or satisfied with their access to health care. Compare that, Heather, to nearly 30% of Americans. So both Americans and Canadians were surveyed as part of this new research. When it comes to needing emergency care, well, some 70% of Americans said they felt confident they would have access to emergency care if they needed it. Compare that with only 37% of Canadians. And the regional breakdown is also interesting because whether you're speaking to Canadians in urban areas or rural areas, what the survey found is that no one is satisfied. People were most satisfied in the province of Manitoba, least satisfied in the province of British Columbia. And what we've heard from the president of the Angus Reid Institute is that, yes, this does seem to be challenging some of those narratives that Canadians have about the healthcare system.
When you look at who can't get care in Canada versus who doesn't have access to insurance in the States, the numbers proportionally are not vastly different. Ask Americans, how is the experience getting care when you need it in a timely fashion? They are exponentially, significantly more likely to say there were no problems compared to Canadians, who in many cases are far more likely to say there are huge problems.
So, Heather, of course, all of this coming after a summer of ER closures, ICU closures. We've been hearing nonstop about the problems with the healthcare system in this country, coast to coast. And now we're seeing and learning more about how Canadians are feeling about it all.
Very timely indeed, Hilary. So if Canadians are experiencing these barriers accessing health care, how is that then affecting Canadians in the experience?
Well, I want to share the story of one man who lives near Sault Ste. Marie. So this is in Ontario. His name is Terrence Graham. About 6 weeks ago, he said that he started to have some really bad swelling in the back of his head. His wife, as you can imagine, very, very concerned. He had blinding headaches, recently lost access to a family doctor. He's a Canadian Forces veteran, so he went to the hospital seeking care. A doctor there said it was urgent, that he needed a CT scan urgently, but he didn't have that scan until 18 days later, and he is still waiting for the results because he needs a doctor to share those results with him. Here's a little bit more of what he told us.
It's like you're walking on eggshells up here with your healthcare. Like, you have to worry about it if something happens. Not only do I not have a family doctor, but after accessing emergency care, from that point forward, I've not seen anybody to discuss the results. I'm still having the headaches. Up here in the north, it's getting to the point where we've lost specialized care. We've lost a slew of family physicians.
So, Heather, the other thing that Terrence said is that this has left him to do something he calls self-doctoring. So trying to figure out what is causing those headaches, what is causing the swelling in his head. Of course, that's not really the sort of situation you want to be in if you are experiencing those sorts of symptoms.
Hilary, thank you very much.
Thank you.